Hey guys, welcome to this session of DigiNerve. Today I'd like to discuss some of the expected questions, the topics which are important for your INI-CET December 2025, November-December exam which is there. So what are the important topics you should be going through? The information which is given, it is the compilation of the last 5-year question, the topics from where the questions they have been asked. I'll add few more too. For jurisprudence, you should go through the declaration of the WMA MTP Amendment Act of 2021, very important. Many questions are being asked. Res ipsa loquitur is again important. You can also add vicarious liability. Liability you can add. Then criminal and civil negligence cases. Difference. The BNS section, section 106, subsection 1 of the BNS. Professional misconduct. These I am adding, which you should go through. Professional misconduct, 6 A's of professional misconduct. Contributory negligence. Defenses against the negligence, they are all important. Then coming to legal procedures, the questions that have been asked from types of evidences. What are the various types of evidences which are there? Oral, documentary, etc. that you should be going through. Hearsay, circumstantial. The new BNS BNSS section, very important. You should just go through the important BNS and BNSS section. It will definitely be one of the section may be asked in the exam. You can add the examination in chief, cross examination, expert witness. You should go through all this topic. Perjury, summons, conduct money. You should go through these topics. They're important. Injury, all the new BNS sections which are important. Grievous injury, 116 of the BNS. And the change is there, 15 days is there instead of 20 days. Please remember, hesitation cuts, weapons and the injury possible with that. Lacerations and incise looking lacerated wound, that has been asked. Abrasion, bruise, it is not cope, this is the chop wound. Chop wound, incise wound, the stab wounds. You should revise these topics. Difference between antemortem and postmortem injury, important. This is about mechanical injuries. Mechanical injury is important for your exam point of view. You can add defense injuries. This has been asked. Fabricated injury. Suicidal, homicidal cutthroat. They are also important. In the firearm, entry, exit, particularly regarding the skull, entry wound, exit wound. Tattooing, blackening, the range of fire, they are important. They have been asked. You can add to it the caliber or bore, cartridge, the various types of bullets, primer, constituents, the gunpowder, so then the characteristics of bullet, class characteristics, primary, secondary. So they are important. In bomb blast, recently questions have been asked, the Marshall triad and the types of injury, primary, secondary, tertiary, quaternary, that are important, that has been asked. Recently, there have been questions from bomb blast injuries. Thanatology, cadaveric spasm, it has been asked, putrefaction, marbling, you can add rest also, the various signs of death, early, immediate, early, late, suspended animation, eye changes, alger mortis, the curve, inverted S-shaped or sigmoid shaped curve is seen, rigor mortis, rule of 12 is important, PM staining, condition simulating rigor mortis is also important, Casper dictum can add to this list. Putrefaction, please read in detail. Organs which resist putrefaction or the order of putrefaction, that is important. And try to read the time since death also. This is psychiatry, forensic psychiatry. The criminal responsibility of the insane. The rules, what are the various rules are there? McNaughton rule, Durrell's rule, Curran's rule, that you should go through. Civil responsibility, can add to it. Then delusions, hallucinations, illusions, impulse, they are all important types and the characteristic features. Lucid interval in psychiatry. Go to schizophrenia, that is part of psychiatry also. Questions are asked from schizophrenia and difference between neurosis, psychosis. And true and feigned insanity. So these are important questions. So please go through, revise. The infanticide, signs of dead-born, this has been asked, but there are various signs, Spaulding sign, Roberts sign, so you should be going through it. Ball sign. Then what is infanticide? The definition you should be knowing. The sections which are related to it. Then how to determine the age of fetus. The signs of live birth, stillbirth, dead-born. The signs that you should be knowing, various signs, very important. Battered baby syndrome, Cafe syndrome, sudden infant death syndrome, Munchausen syndrome by proxy, that is also important. Please go through. Next, in thermal burns, we have the flame burns, how to calculate the total body surface area, heat exhaustion, heat stroke, scalds, lightning burns. They are important. And the degree of burns, first degree, second degree, third degree, Wilson's classification also. Wilson's classification may be asked. Then the PM changes, the PM findings in burns, very important. Thermal burns. The findings in scalds also, they are important. Please go through. The cause of death in burns, they are important. Next, in asphyxia, various types of strangulation methods. It has been asked: positional asphyxia, ligature mark in hanging in strangulation, drowning, the types, findings, and diatom test. They are all important. They have been asked. So to add to it, can discuss about hanging, the types, and PM findings. Again, similar to it, strangulation, types, and PM findings. They are important. Throttling also. Throttling or manual strangulation. Hard bone fracture may be asked. Traumatic asphyxia, findings, smothering, They are important. Cafe coronary. Cafe coronary is also important. So drowning, I have already mentioned the question they have been asked. Next, in sexual offences, definition of rape, very important. Consent related to it, consent can be given, and the various BNS sections related to rape and punishment section. Please go through sections 63 to 71 of the BNS. Rape survivor examination and the BNSS section, which is important for rape survivor examination. Examination of the accused has been asked, leukocidin test has been asked, various paraphilias, very, very important. It has been asked multiple times, various paraphilias. The cry of the fetus, when it can be heard, that has been asked. To add to it, we have the signs of pregnancy, presumptive, probable, the positive signs of pregnancy that you should go through. Positive signs of pregnancy. Lochia, that you should go through. The level of uterus after delivery, that is important. Causes of erectile dysfunction in males. Quad, frigidity, these are important terms. Frigidity, vaginismus. Examination in the case of sodomy, that is also you should go through. I think that will cover sexual offences and the allied topics. Pervaginal examination, that is banned. You should remember this. Pervaginal, that is two-finger test, that is banned by the Supreme Court. There are two terms, superfecundation, superfetation. They are also important for your exam point of view. These are important terms. Atavism, posthumous birth, illegitimate child, you should be knowing this term. In criminal abortion, the abortifacients which are used. The sections dealing with criminal abortion, the latest BNS sections, and the abortifacients. Important for criminal abortion. Next, in identification, eruption of teeth and age estimation. It has been asked fingerprints, DNA fingerprints, the samples that is to be preserved, the appearance of the ossification centers and their fusion, determination of age, the X-ray site for the determination of the age, which site you are going to order to determine the age of the person, dental formulas, whatever the dental formulas are there, please revise that. Male or female, depending on whether the skull, the pelvis, how to determine it, the features of male or female skull or pelvis that are important, has been asked. Can I add to it like medico-legal importance of various age groups, the cephalic index for race, determining the race, then disorders of sexual development. The Turner's Klinefelters, they are important, they have asked. Then Gustafson method in age determination. Gustafson method, please go through that also. Tanner staging for puberty. Tanner staging, that is important. Stature determination, the formulas which are available. Little bit you can go through tattoos, scars, etc. Fingerprints, I have already told you, dactylography, here you can go through here, the medullary index. And little bit about palatoscopy, also please go through. Poroscopy, palatoscopy, all you should go through. Odd question may be asked. In the autopsy, which cavity is opened first, including the fetus? We can add the various types of incisions. Which cavity to open first in adults as well as in fetus. The various types of incisions, the evisceration method. What are the various evisceration methods like Letius, Gons, Rokitansky that you should be going through. The purposes of autopsy, the viscera which is preserved, viscera preservation, everything about viscera preservation. What are the samples which are preserved, specimens, samples, preservative use. They're all very important. And discuss about embalming techniques and exhumation. An odd question may be asked, embalming, exhumation, and to determine the age from bones. So skeletal structure examination, skeleton examination, that is also please go through. And in toxicology, the important topics are classification of poison, chelating agents, the various chelating agents which are used, antidotes, please very important antidotes for various poisons, metallic irritants like arsenic, the signs and symptoms, treatment, both in acute and chronic stage, Blackfoot disease related to arsenic, lead, mercury, barium, they're all important. The questions they have been asked. You can add copper also, copper sulfate. Non-metallic phosphorus in the plant, active principles of the various plants, and identify the plants. The image may be given to identify the plants. In animals, snake bite, very, very important. Scorpion, sometimes an odd question may be there. Cyanide is very important. Carbon monoxide is very important. Cocaine, multiple questions they have been asked. Signs and symptoms, Magnum syndrome. Drunkenness, alcohol intoxications, methanol, very important. Methanol particularly very important. Opium, heroin, very, very important. So all the toxidrome you should go through. Toxidromes you should revise. Medicinal, iron poisoning, calcium oxalate, can add to it aspirin, acetaminophen, paracetamol, then it can be benzodiazepines, you should go through. OPCs and alphas, very, very important. Alphas, silver nitrate test that has been asked. Silver nitrate, paper test, filter paper test that has been asked in the exam. And for OPC, everything is important. Signs and symptoms, mechanism of action, treatment, all are important. Management, complication, please go revise OPC. We can include some other poisons like cannabis, nicotine, strychnine, they have been asked. The recreational drugs like LSD, amphetamines, that can be asked. I think I have covered most of the topics which are important, and if you go through, I'm sure you will get the full score. Thank you.